Hello, my name is Dr. Nirav Patel. I'm an orthopedic surgeon specializing in hip and knee surgery. My role at Johns Hopkins is orthopedic surgery and in particular joint replacement, including reconstruction and revision procedures. As part of this, I help train medical students, residents and fellows at the university, but also undertake research in multiple areas of the subspecialty. My research interests are varied. Firstly, I have looked at preoperative optimization, which basically gets patients in the best possible condition prior to surgery to ensure good outcomes and minimal complications. I have also looked at returning to sport following total hip and knee replacement surgery, specifically the timing and level of sport from amateur to elite. I have looked at enhanced recovery after surgery, or ERAS, and this follows a series of guidelines which helps us to improve the outcomes following surgery and helps control pain levels. As part of this, I also have looked at opioid-sparing surgery, where we look at treatments other than narcotics to help control pain after surgery, specifically joint replacement. I went into this field to help patients in pain and help restore their quality of life, specifically getting them back into an active, happy, and healthy lifestyle. Joint replacement offers an excellent way to restore quality of life, which is highly rewarding for me. I provide treatments from medicines to injections, from bracing to physical therapy, and specifically joint replacement. It is a complex and dynamic field with elements in physics, bioengineering, technology, and robotics, which I find highly interesting and challenging. It also allows me to contribute on a larger scale by training future doctors and surgeons, but also undertaking research at a national and international level to advance the field of orthopedic surgery. My philosophy of patient care is to treat everyone as if they were my family. And as part of this, I like to practice with evidence-based medicine where possible, but also exhausting all non-operative treatments before we undertake surgery. I place great importance in open lines of communication and transparency of care, as well as shared decision-making and mutual respect. I was born and raised in England, and therefore my training is a combination of that from the UK and US. My wife Caitlin is a Maryland native, and together we have a toddler who is very lively and keeps us on our toes. When I'm not working and caring for patients, I enjoy cooking, good food, travel, reading, playing racket sports, and working out. Thank you for your time, and I look forward to meeting you.